Hello? Is your heart in good condition, or is there a little issue? Today, I will talk about the 7 signs in your body that may indicate your heart is not at its best. We know that cardiovascular diseases are the #1 cause of death worldwide. So, stay alert. But before we continue, don't forget to subscribe to this channel, like this video, and share this knowledge with someone else. Now, let's explore the 7 signs that you should be aware of, indicating a potential heart issue. 7th sign, Frank's sign. From now on, it's crucial to pay closer attention to people's ears, as a small sign in this area may indicate a severe obstruction in the heart's arteries, both coronary and carotid. In the 1970s, Dr. Sanders Frank noticed that many angina patients had a diagonal crease in their ears. Although the connection between the heart and the ear is not fully understood, one theory suggests that the same factors damaging the inner lining of arteries may cause this crease in the ears. Out of every 100 people with this diagonal fold, 30 show no problems, considering it merely a sign of aging, while 70 may have artery obstructions. The likelihood of indicating coronary or carotid obstruction is higher in younger individuals. Therefore, if a 40-year-old exhibits Frank's sign, it requires more attention than an 80-year-old, where the fold may be more easily attributed to age. However, the sensitivity of this sign is limited, as only 40 out of 100 people with a cardiac blockage exhibit this characteristic. 6th sign, hair loss on the legs. The loss of hair, initially on the legs and later on the thighs, may indicate the presence of peripheral artery disease, characterized by obstructions in the arteries of the legs. Due to the widespread nature of atherosclerosis, obstructions in the legs may suggest the presence of blockages in other arteries of the body, including the coronary arteries that supply the heart. Typically, symptoms of peripheral artery disease are only noticed when atherosclerosis is in an advanced stage, resulting in insufficient blood and oxygen due to the accumulation of fatty deposits in the arteries. Since hair follicles rely on healthy blood circulation for hair growth, hair loss on the legs can be a sign of this condition. Other indicators include smoother and shinier skin, cold skin, and a decrease in nail growth. However, it is essential to emphasize that hair loss on the legs can have causes other than peripheral artery disease. 5th sign, xanthelasma. When observing someone's eyes, it is possible to notice a yellowish spot on the eyelid, known as xanthelasma. It is generally not painful and manifests as a slowly growing aesthetic concern. Xanthelasma, which is the most common form of this phenomenon, consists of cholesterol deposits on the skin. It is prevalent in middle-aged women and is often found in the inner corner of the eye, especially on the upper eyelid. About 50% of patients with jaundice exhibit dyslipidemia, indicating elevated cholesterol or triglyceride levels. The presence of xanthelasma is rare, occurring in only 1% of individuals with high cholesterol levels. However, studies suggest that this condition is associated with an increased risk of heart diseases, heart attacks, and strokes. Therefore, individuals with xanthelasma are advised to undergo blood tests to monitor and ensure that cholesterol and triglyceride levels are within normal limits. 4th sign, senile arc or senile halo. As the name suggests, the senile arc is an age-related manifestation and is more prevalent in older patients. It is caused by cholesterol deposits on the edge of the cornea, presenting a white or grayish shade visible above and below the outer part of the cornea. In some cases, this halo may overlap with the iris, the colored part of the eye, leading to a perception of lightening in comparison to the previously darker shade. While the senile arc does not affect vision and does not require treatment, it may indicate a problem if it appears in younger individuals, before the age of 45, suggesting the possibility of severe dyslipidemia, i.e., elevated cholesterol or triglycerides. In these cases, there is an association with an increased risk of heart diseases. For the elderly, the presence of the senile arc is considered normal, observed in about 60% of people over 60 and approximately 100% after the age of 80. 3rd sign, cyanosis. Cyanosis occurs when the skin takes on bluish or purplish hues. If a region of the skin shows this discoloration when exposed to heat, it may indicate that this part of the body is not receiving adequate blood oxygenation, while turning red. The presence of cyanosis may suggest a possible arterial obstruction. When accompanied by shortness of breath, this condition may point to pulmonary issues such as pneumonia, emphysema, or pulmonary embolism, or even heart failure, characterized by the heart's inability to pump sufficient oxygenated blood. Additionally, congenital heart defects, such as tetralogy of Fallot, can also be causes of cyanosis, broadening the range of potential cardiac origins for this manifestation. Second sign: ulcer. The presence of persistent wounds on the legs or feet may be indicative of poor circulation. This occurs due to arterial insufficiency caused by obstructions in the arteries that supply these regions, resulting in difficulties in walking quickly due to increased leg fatigue, pain, and, in some cases, cramps. Such ulcers are usually painful, except in cases of nerve damage, such as in diabetic neuropathy, where the sensation of pain may be compromised. Arterial ulcers typically appear on the outer part of the leg and at the base of the toes, and they rarely cause bleeding. On the other hand, venous ulcers, more common in association with varicose veins or venous thrombosis, affect the inner part of the leg and often cause bleeding. First sign: swelling in the legs, ankles, and feet. Edema or swelling in the legs and ankles can be caused by a weakened or dilated heart, resulting in the accumulation of fluids in the body. This increase in fluid can make your shoes and sneakers feel tighter, particularly evident in the ankles, resembling the appearance of bread rising during the baking process. Pressing on the area creates a depression known as the dimple sign. Swelling in the legs and ankles is most noticeable at the end of the day when the pressure on the leg veins is heightened due to gravity. Lying down and elevating the legs can help reduce this edema. If you notice any of these signs in your health, it is crucial to seek the guidance of a healthcare professional as soon as possible. If this content has been helpful to you, consider sharing it with friends and family. Don't forget to subscribe to the channel to receive more information about health and well-being. Thank you for your attention, and I hope to see you in future videos. Until then, take care and stay healthy.